Are your fallopian tubes blocked and you are trying to become pregnant? Pay attention to this video. It might be useful to you. Please share this video and my heavenly Father will bless you abundantly. In this particular video, I'm going to be answering your question, talking about the researches I have conducted regarding to the issue of becoming pregnant with tube blockage. So sit down and watch the video. Before I proceed, I would like to put a disclaimer that myself, Tochi, I am not a medical practitioner. I am not an expert. I am not a professional. I am a researcher who research about fertility, and after that I impart knowledge on women trying to conceive. So if you have any issue, question, endeavor to contact your physician for proper medical checkup. I only teach based on my research and my experience. Please take note. So now back to this video. Before we go through the video, I want you to understand what fallopian tube is and the role it stands in your chances of becoming pregnant. Every woman, myself and you, if you're a woman watching me, we have two fallopian tubes, and this fallopian tube plays a vital role when it comes to conception. Now I will let you know. Fallopian tube serves as a passageway whereby your husband's semen goes through to fertilize the egg. And again, another important role that this fallopian tube plays is that when this egg is also fertilized, it is through the same process that it will go and implant. This is why a lot of women who are suffering from this find it difficult to conceive, because the egg doesn't mean that you might not be ovulating. If your tubes are blocked, definitely you might be ovulating. But the key factor here is that even if you ovulate, there is no how the semen can pass through and fertilize the egg. Let me demonstrate it with my finger. It's just like I have appointment with you and we are to meet here. Then myself coming to meet you here, you cannot move out of this place. You must be here waiting for me. Then I have to come through this way to meet you so that we will have our discussion, or we will go where we want to go. So now me coming from this way, on getting to this passage, this is the passageway that I will pass through to come and meet you. Now on me reaching here now, the passageway is blocked. There is no how I can come and meet you there. That is how it is. I don't know if you people understand my demonstration. This is the little demonstration that I can do about this. The remains for fertility experts and gynecologists. So this is simple how it is. So if you have the two tubes blocked, which means there's no way or how the semen can fertilize the egg, it doesn't mean that you are not ovulating. Now let us look at the factors or what can cause your tube block. Now let me remind you, if it is only one tube that is blocked, you can still become pregnant with the other one. We are talking about whereby you have bilateral tuber blockage, which means the two fallopian tubes are blocked. If it is only one, definitely you will become pregnant with the other one naturally. But in a situation, there has not been a satisfied, according to the researches that I have conducted, that if the two tubes are blocked, that you can become pregnant naturally. No. If anybody is telling you that if your two fallopian tubes are blocked, you can become pregnant naturally, I am not agreeing with that, except if it is by miracle. So, but if it is only one, definitely you will. Let's look at the causes of this, what can lead to tuber blockage. One is sexually transmitted disease. Sexually transmitted disease. Why I always encourage women that if you have any infection, please treat it. Do not allow your infection to escalate. Always go and have yourself checked, whether trying to conceive or not. If you have any infection of any kind, make sure you speak with your gynecologist. Stop going to the unprofessional. My own here is to teach, educate. I cannot prescribe anything for you. I only teach you, like I'm telling you now. If you have any infection, contact your physician. These people will check and know the type. Sometimes you see people coming to me, I have this, what should I take? I am not a medical practitioner. I cannot prescribe medication for you. You go to your medical practitioner, check, because if you do not treat it on time, it will lead to your fallopian tube blockage. Did you get that? So another is infection. Any kind of untreated infection can lead to this. Another one is inflammatory disease. It can lead to this. Another one is endometriosis. Endometriosis is a condition whereby the tissues that's supposed to grow inside your uterus starts forming outside, thereby disturbing and can lead to tube blockage. Another one is previous surgery can cause injury to the fallopian tubes. For example, people who undergo appendix operation. So during this period, they might have injury and it may lead to tube blockage. Are you people getting me? Now, somebody may ask, then how can we get pregnant if our tubes are blocked, since you said we cannot get pregnant naturally? And this is my answer. This is what I find out during my research. One, you need assisted reproductive techniques known as IVF or in vitro fertilization. In this process, your egg will be collected. They will stimulate your ovaries to produce multiple eggs. When this egg is matured, they will retrieve it and they will fertilize it in a tube in a laboratory. They will take your husband's semen and fertilize it. After fertilizing it, they will keep it in the incubator for about 3 to 5 days, watching the ones that will survive. The ones that will survive, they will now implant it back in your uterus and wait for the implantation. If the implantation is successful, then congratulations, you will become pregnant. Some people shy away from IVF. Some people said, oh, I have done it several times, it's not working. Some people think have this mind about IVF. Come on, it's the same thing. It's the same thing. If you want to have a successful IVF, before undergoing it, make sure that you conducted the necessary tests. Not when they ask you to go for this test, you say you don't have money. And when it fails, you will condemn the hospital. No, you must undergo every necessary test and make sure that you go to a special IVF center. Don't go because your friend said this one is good. You have to conduct your research, speak with the specialist, follow their procedure, obey the instruction, and it will work. Then the way that you can become pregnant with blocked tube is through what is known as surrogacy. Surrogacy is a situation whereby you have a donor. You have a donor, or you can use your own eggs, but another person will help you to carry the pregnancy. Every genetic thing in the baby will be yours because they will collect your egg and your husband semen to fertilize the egg. Then the only thing that the person will do, the surrogate mother will do, is to carry your pregnancy. Once the baby is delivered, it is yours. Even if you go for DNA, the baby will not have any genetic from the carrier, but rather from you. So this is another one. This is old practice. I don't think people are using it now. People that are doing it are old medical practitioners known as hydrotubation. This is a process whereby they try to flush your fallopian tubes. At this process, it might be open. Many hospitals right now, according to the researches that I conducted, they are not following this process. Once you go and they find out that the two tubes are blocked, they will encourage you to undergo IVF or surrogacy in order to become pregnant stress-free, because you might go and do this method, the following day the tube might block again, but the other ones, IVF and surrogacy, they are satisfied and proven way for a woman whose fallopian tubes are blocked to get pregnant. I believe I have tried to explain in this video. This is my research that I found out how people that their fallopian tubes are blocked can become pregnant. Like I told you earlier when I started this program, I put a disclaimer that I'm not a medical practitioner. I study these things, I conduct research, and this is my findings. So you might like to also go to your physician, make your own research, make inquiries on how you can become pregnant with a fallopian tube. I am not a medical practitioner, I'm not an expert, I am only a researcher. When I research, I come to teach. Remain blessed. Please like and follow my page. Subscribe if you like what I'm doing. God bless you.